we're following up on a conversation that we had last week with Greenwood LaFleur Hospital. We were talking sleep apnea. This week we're welcoming Dr. Todd Fincher, who's a dentist over in Greenwood. Welcome back, Dr. Fincher.
Good to see you again.
Glad you were here. You know, when we talk about sleep apnea, typically I don't think folks would think a dentist would be the person that we would want to talk to, but you play a major role in making sure that people maybe who deal with this are really kind of safe throughout the night. How does what you do impact them?
Well, dentists get their referrals from the physician, of course, from the primary care physicians for people with obstructive sleep apnea. What dentistry has moved into is the fabrication of a device that these types of patients can wear at night to help them with their obstructive sleep apnea, to keep them from obstructing. And what obstructing is...
That's what I was about to ask. I'm like, what, obstructive sleep apnea, okay. That's a big word.
So think of it, let's break it apart. Obstructive sleep apnea, the obstructive part is when people lie down, their throat closes and their saturation of oxygen to their brain decreases, which causes them not to sleep.
Which is kind of what we're talking about. That's the basic definition
of
sleep apnea.
That's sleep apnea. So they're losing sleep, they're non-functional at work, they're having accidents driving, and they're not getting good sleep. So what dentistry has developed is a type of removable appliance, much like a mouth guard, but custom fitted for the individual patient, that they wear at night that repositions their jaw, specifically their lower jaw, to move the lower jaw forward, to open the airway, to increase the oxygenation, to hopefully allow for a better night's sleep, and to saturate the patient with oxygen so that their brain is functioning better.
That's a pretty amazing deal. I know you brought the device. We're going to look at it in just one second, but I want to ask one more quick question this morning. When we talk about people who deal with sleep apnea, does it matter if you're a child, if you're an adult? Who does this really affect?
It actually affects both, and that is something that is new to me. I never suspected until I started studying this that children could have sleep apnea. But over the years, I've had countless parents come to me saying, my child snores. Is there something wrong? Well, lo and behold, there is something wrong, and it is usually enlarged adenoids or tonsils that is causing the child to reposition their tongue in the way that causes snoring. So yes, it's not as critical with children as adults, but it needs to be diagnosed in children, because then they're going to have the same problem as adults, if not treated in childhood. So the treatment usually is removal of tonsil and adenoids by an ENT.
And really quickly this morning, when you talk about snoring, is that a good key factor, or I mean, is it if you do snore, is this something that you're susceptible to?
Highly. There's a high correlation between snoring and obstructive sleep apnea. So it's a symptom just like any other symptom, like a cough is a symptom of a cold. Snoring is one symptom of obstructive sleep apnea.
Now talk about this device. Now we mentioned this earlier, but can we see it at all?
This is made by Microdental, which is simply the company that we use. There are many of these on the marketplace, but I think Microdental does a great job in the fabrication of this. All this is a two-piece appliance, one for the lower arch, one for the upper arch. They fit together so that the patient is moved forward. You can see how
so it fits. It's like a mouth guard, kind
of. One goes on your upper arch, one goes on the lower arch, but it has these wings so that the dentist will position you in the optimum airway position. So it's not to increase stress on your TMJ, but to open your airway.
Wow.
When Sherry talked with you guys last week from Greenwood LaFleur Hospital with the Sleep Center, we partner with them to fabricate these and then have the patient retested as far as their saturation to see exactly how far they need to be moved.
Wow.
So that you get optimum saturation or optimum oxygenation.
So it's really neat how you work with the other department, because you really find out exactly what the patient needs.
Right. It's called titration. So you're trying to titrate this patient to the optimum saturation to get the most oxygenation in without protruding their jaw into an uncomfortable position.
It's absolutely amazing where we've come with technology. Absolutely amazing. Dr. Fincher, if folks want more information about what you do or with Greenwood LaFleur Hospital, how can they get that?
Yeah, two websites. GLH.org is a hospital's website. It's linked to me. I'm linked to them. My website is drtfincher.com.
Fantastic.
So glad to be here and appreciate the opportunity to talk with you.
Hey,
on
thanks
this.
so much
Yeah.
for coming and making sure. Now, if you have more sleep apnea questions, you can contact them at Greenwood LaFleur Hospital. And if this is something you deal with, give them a call and go see them at the Sleep Center as well. Dr. Finch will make sure you are taken well care of. Thanks again for being here
You're
this
welcome,
morning.
Hunter. Have a good day.
So we've got more coming up after the break. We'll be right back.
This Health Matters segment is brought to you by Greenwood LaFleur Hospital.